Hello, everyone. Welcome. We'll just give a few moments for people to get all logged in. So thank you for joining us today for our seminar, Grand Rounds, Impacts of Wildfires and the Environmental Public Health Workforce. My name is Nicole Dutra. I'm a Senior Project Coordinator here at National Environmental Health Association, or NEHA for short, and I will be your host today. Let's kick off today's seminar with a quick poll for the audience. So approximately how many wildfires have burned in the United States this year alone? We'll give a few more moments for people to chime in on that poll question. How many wildfires do you think have burned in the United States this year alone? All right, it looks like most of you selected 28,000. All right, well, according to the National Centers for Environmental Information's August 2023 wildfires report, there have been approximately 40,000 wildfires across the US already this year. So there's just some food for thought for all of you. Let's go ahead and continue with the seminar. To begin today's seminar, I will provide a brief overview of who the National Environmental Health Association is and what we do. I will provide some details about our 2024 annual educational conference. Then I will introduce our speaker who has an amazing presentation planned for you today. I will share with NEHA's recently released Wildfire Response Guide, and then we will move into the panel discussion with 4 experts working in the field. With that, allow me to cover a few housekeeping items before we get started. Please note that this seminar is being recorded. The seminar recording will be uploaded onto the NEHA Environmental Health Grand Rounds webpage. You can also find recordings for all of our previous seminars there as well. The web address is www.neha.org/EH-grand-rounds. If you have any questions for our speaker during the presentation, please use the Q&A box to submit your questions, and we will attend to them after the presentation. In addition, if you have any questions for our panelists during the discussion, also please use the Q&A box to submit your questions. You can find the button at the bottom of your screen, the one that says Q&A. At the conclusion of the seminar, you will receive a link to take part in an evaluation survey to provide feedback and comments on today's seminar. Now, for those of you who may not be familiar with NEHA, allow me to provide a brief overview of who we are. As an association, everything we do is to build, sustain, and empower environmental public health professionals so that they are equipped and prepared to protect the health of communities across the country. We support environmental public health by continuously providing the most up-to-date trainings, tools, and resources to the workforce who specialize in so many different fields considered environmental public health. NEHA is focused on increasing knowledge and skills across all of our fields to build upon our workforce capacity, efficiency, and effectiveness. We also offer credentials to certify the expertise of our workforce. In addition to our large online library of trainings, seminars, and available tools and resources, we host an annual educational conference, which includes multiple sessions focused on the many different fields of environmental public health, like policy and regulation, extreme weather preparedness and response, food safety, private wells, water quality, climate change, wildfire response and recovery, and so many more. Also, our 2024 annual educational conference and exhibition will be in Pittsburgh, Pennsylvania on July 15th through the 18th, 2024. Our focus will be on new horizons and building bridges to shape the future of environmental health. If you are interested in submitting an abstract, you still have time. You may do so through October 9th. Exhibitor registration is currently open, and attendee registration will open on December 1st. You'll be able to find more information at neha.org/AEC. No matter where you are in your educational journey or your professional career, NEHA has something for you. Check out our website to learn more. Now I will introduce our guest speaker. Please welcome Lane Drager. Lane will be presenting on the impacts of wildfires on public health and the environment. Lane has worked for Boulder County Public Health for 19 years and currently serves as the Consumer Protection Coordinator in the Environmental Health Division. Lane also serves on the Jefferson County Board of Health. He is a graduate of the Regional Institute of Health and Environmental Leadership's Advanced Leadership Training Program and has served as a peer coach since 2009. Lane, I will pass the floor over to you.
Thank you so much. Thank you, Neha, for hosting this, and then thank you all for attending. So appreciate the interest. Well, wildfires, if you haven't had to deal with them, I consider you fortunate, and I hope that is how it is maintained throughout the rest of your career. That being said, here's a look at last calendar year, just the occurrences of large fires. So this isn't even all fires. And again, we've just seen in this year, 40,000 so far, which is a staggering number. And I would have educatedly guessed correctly, even though I was not allowed to guess as a panelist. But something, I'm located in Colorado in the West, this is something that we know a lot about, and it is not limited to the sort of the arid West. We live in a high desert climate, so we know it's dry, and fires are always something that we're concerned with. But this is something that's really hitting everywhere, and we know Hawaii has certainly been pretty devastated recently with fires. So something everyone across the country needs to be prepared for, and I think that's one of the key messages you're going to hear from myself and probably colleagues is trying to deal with a fire when it's happening is going to be too late. You're really going to need to spend some time thinking about what it's going to take for you to respond before you're in that circumstance. So wildfires in the US, this is kind of where climate change is playing this role is trying to see if I can move this box. It's right in the middle of my slide so I can see what I want to say. But this is something that we've seen in Colorado, that we're seeing more frequent, more severity, something really trying to cross the US, and something that we're expecting to continue to increase throughout the next several decades. Climate impacts are real. They're already here. It's not something that's a future event. This is a current event. But this idea of longer seasons for firefighting, and then these idea of mega fires, these really significant fire situations. This is just for California, and this is what's so frightening to me, looking at sort of the top 20 largest fires that California has dealt with, and when have they occurred? So you're looking at over 75% of those things have happened in the last just over 10 years, and so something that to think in the next 10 years, this chart may be obsolete, that maybe these large fires won't even show up. Those are frightening things to think about, but important things on the planning stage to have it in your mind and be really, really, really thoughtful of. This is just kind of a count for Colorado, what we've seen, the number of wildfires and the number of acres burned. And, it's all over the place of when we have a bad year to a good year. And again, a good year means it's maybe only 40, 50, 20,000 acres are burned. So that's, again, frightening to think that there is no such thing as a year where we don't see acreage burned. So into the future, that could, again, get higher and higher. This is where myself and a couple of the colleagues on the panel work. This is Boulder County, Colorado. And these are some of the fires that sadly my colleagues and I have had to live through and work. This one does have the most recent one in 2022, but we've seen, you know, a number of big fires throughout our 10-year working in Boulder County Public Health. And so sadly, these aren't the things you want to gain a lot of experience in, but we have learned because we've had to deal with a number of them. This is kind of the map that will be updated soon, and I think it may already have been in the Colorado. So this one is showing, again, where I work, Boulder County, and our designated high risks for wildfire. And the thing that's on here where you see white, that would be showing little to no risk for wildfire because these are developed areas and municipalities. And we certainly know from the last wildfire that we had to deal with, it did impact municipalities. In fact, it was the worst impact wildfire we've ever dealt with because it did make it to an urban area and then really devastate that area. And that was the Marshall Fire. So a little bit, I'll talk about that, but I will share something after the presentation. I don't think we'll have time to go through it. It gives you a little synopsis of kind of what it was like when the fire started and how fast it was moving, how devastating it ended up being. It's kind of a 911 case recording of what was happening in Boulder County. But this is one of the subdivision areas that was impacted by the fire, and you can just see that when the fire hit there, it really didn't leave anything. You know, there's not even much of the structure of homes left in the area that burned in those residential spaces. So this is the one, I won't play this, but I will share this in the chat afterwards. I don't think we'll have enough time to hear it all, but something you can review after the end of the presentation. Just some images of kind of the impact of that most recent fire that did make it to urban areas. So really changing the look and feel of what you're responding to as an EH professional when you go from dealing with things in a rural forested area to suddenly it hitting an urban area. And I know Christine has unfortunately also a lot of experience with those kind of fires in California. This is an aerial view of the smoke plume from that fire. Really a devastating fire because of the conditions. So again, how climate change plays a role. This fire happened on December 30th, and it's really unheard of for us to have no snow in December 30th in Colorado. And not only do we have no snow, there was obviously plenty of fuel for the fire, and then we had over 100-mile-an-hour winds when the fire started. So this fire was moving in just an incredibly rapid pace to the point where firefighters really had to struggle of where they could even think to focus their attention. So really just some devastating impacts of, again, climate-related storm. This is an image. The fire had jumped our major highway that goes from Denver to Boulder. And now that it's on the other side of the highway and heading right, this is from the roof of the hospital we had to evacuate. And then behind this hospital is a mental health hospital that also had to be evacuated. Miraculously, the fire burned around the hospital and did not damage the hospital at all. And they were very quick to get their air handling units shut down and really stop the risks to that place. So certainly when we think of impacts, environmental health related issues, air quality is an immediate as well as potentially a long-term focus area. So these are some images. My colleague Bill was the one who coordinated these efforts, but looking at doing air quality monitoring really after the fire to think about burn areas, areas that children would be active in, and what kind of safety, what kind of risks are present in these areas. And so during a fire, smoke obviously is a significant concern. The difference between the most recent fire and some of the other wildfires is now instead of just wildland areas burning and trees burning, we had homes burning. So all the things that were inside of that home are now burned up. So all the plastics, all the chemicals that people have. So the potential toxic plumes in the smoke is very different than just our traditional wildfires that we've dealt with. In addition to then these burned areas, what are the risks for ash and other things being disturbed? So it was an extensive effort that Bill and his team and many partners coordinated to put air monitoring both in ambient areas to see what was happening outside, and then did extensive monitoring post-fire within homes to identify what kind of hazards were still present. So homes that did not burn up now have a unique issues of they were inundated with those toxic smoke plumes, and what potentially is still lingering, what should we be looking for, how long does it persist, and what are the mechanisms to kind of remediate and lower those risks to the ones that are more to be background level and things where people can re-inhabit those homes. And this last fire that we dealt with was very unique to see major areas burn and then it somehow migrate around other very dense developed areas. So again, people that were right near or next to places that burned, but did not have actual fire damage themselves, just significant smoke damage. So again, more unique challenges that we hadn't seen in previous fires. Bill's team also did an amazing job of communicating what they were finding to the public. So people could go and set up accounts and log what was happening with those ambient monitors and see what was happening in real time within the community. So again, a way to share information back to the community, hopefully take some of the burden off of people trying to find out what is happening and being as transparent as we can be with what we do know and also what we don't know. Water quality, significant issue during the most recent fire we had because it impacted municipal water supplies. One of the municipalities had to draw raw water into their municipal supply to fight the fire. They really did not have enough capacity with the water in the current system. So they had to bring in just raw water, and that then compromised that infrastructure. So they had to have a significant time where there was not available to have potable water throughout the city, even though the fire was no longer an immediate issue. It also had significant impacts for areas that were outside of the municipality. So one of the things that environmental programs focus on is wastewater treatment systems, septic systems that are at the residential level. And so impacts to those systems, in addition to impacts to private wells, which so people that are not served by a municipal water supply, and looking at what are the risks there. And one of the things that Aaron, another colleague on the panel, is able to do is work with other partners to identify risks within water supplies. Things that people may not have thought about is volatile chemicals potentially being in the water because of the infrastructure being compromised, the heat of the fire potentially impacting plastic lines and some of the infrastructure. So working with universities to do studies and identify information so that we could really help people who are now solving their own water issues because they're on a private well. So there is no one else looking out for their water quality. They're kind of in that role themselves. And so here's one of the Purdue staff persons that was assisting in that. So Purdue University was a great partner. And it's, I think, a plug for folks to think about the need for partnerships, even if the universities aren't within your jurisdiction. So Purdue is in Indiana and we're in Colorado. And yet we were able to establish, great partnerships both locally and across the country to get support to look at some of these impacts. The other sort of long-term components, when you think of water quality, are areas where those that have burned creating runoff issues. And for us in Colorado, potentially even, mudslide and other landslide type issues because of the change in elevation across those topographies, but definitely issues for all of that getting into your water supplies as it gets into your storm drains and directly then into your surface water and all those impacts that come with that. And in this case, again, when you have an urban area burn for our most recent fire, it isn't just wood that's burning. Now we have all those chemicals and all the potential issues of potentially asbestos debris. And in our case, it did snow the next day after the fire, which I guess was good in some senses to help make sure the fire didn't persist. But now putting water on top of areas that that have yet to have any kind of remediation at all. So the impacts of potential stabilization for runoff is a significant risk, depending on what kind of rainfall and precipitation your area might get. On the food safety side, would say we were not as impacted environmental health staff-wise. This is one of the programs that I help oversee. Places that were impacted to the point where they were burned up, we're certainly not going to be operating the next day. We also had the situation where there was no potable water, so restaurants really weren't able to operate immediately after the fire. There was significant smoke damage, so we are fortunate that we had prepared some disaster guides to deal with different incidences for restaurants, and we were able to get out there within a few days, do some site visits, get information in people's hands. But really, for places like in this picture, they're not going to be reopening until they can rebuild. So we're really looking at a delayed impact on food safety, where we will have to work with them to do plans and really do a rebuild and reopening. The places that had the smoke damage were ones where we were trying to help them figure out their remediation steps once they had potable water again, running through some of the impacts that they will need to reopen their restaurants. But largely, we saw the impact to be in the residential areas, not as significant for commercial structures in the most recent fire we had. Fortunately, as fortunate as you can be for how many structures did actually burn. Another significant role environmental health is likely going to play, which is in that recovery phase, which is so much longer than the actual emergency phase, is figuring out issues with debris removal, all the potential hazardous waste. As I mentioned, asbestos being a component within some of those residential burn and any kind of structures that are burned, looking at issues related to soil remediation, how much soil needs to be removed to get to potentially more background levels of contaminants, how much sampling are you going to do, setting all those kind of things. So these are significant issues that are going to come up, and having guidance and support for how you're going to approach that is going to be monumental for you, as there's going to be so many issues to deal with. Thinking about rights of entry to get into properties and people agreeing to support and use if the county is organizing any of the removal processes. How are you going to navigate those spaces? So lots and lots of things that you're going to have to navigate. And again, to have resources to support you is going to be very helpful. This is just another picture of kind of some of those remediation projects in our most recent fire that again hit those urban areas. Another, I think, big component is just how you communicate. So obviously there's lots of risks going on. People have lots of concerns. Sharing as much information as you can, having press releases pre-scripted. Those were things that we were able to navigate and just update with more current information to get information out to the community. Having clear websites, communication, if there's joint information centers that are set up for your disaster response, all that information is flowing, so there's consistent messaging going out, using social media and all sorts of avenues, next door, whatever it might be, to get information in people's hands of where they can find what they need. The county mobilized a disaster assistance center, as they have many times with other disasters. This will be a role where environmental health will certainly be at the forefront of sharing information. People want to know, when can I get back in my house? What do I need to do? How do I know it's safe? A word that we are always hesitant to use. And we're really focused more on how do we reduce risks to a manageable level. But these are all going to be questions and things that people want answers to, in addition to support of how do they navigate the insurance issues and all the other things that they're going to be dealing and struggling with. So setting these kind of activities and centers up are really essential to reconnecting people and giving them something that they can do. They've been feeling helpless for a while now and feeling a sense of loss. And so having a resource, mental health resources for them, for all the things that they're navigating is really essential. Some of the things that, again, I would want to highlight that have been successes for us, and we may talk a little bit more during the panel session, but how important pre-planning is. Really the work that you would do to identify what critical infrastructures are there. GIS plays a critical role in that, where so you can identify what's going to be and what has been impacted. Then really disaster guides, I show a picture of one of the ones that we had developed. Those focus more for our retail food establishments, our restaurants, but having those resources handily available and getting them out to folks. All the relationships that you need to build so that when you're in the middle of a disaster, you know who you can call on. You've worked with these people. Incident command system training. Those are essential things so that when you're in an actual incident, you know how to function there. You know how to work with all your Office of Emergency Management, the firefighters, and all the emergency responders, as well as the other folks that are going to be setting up sheltering and all those kind of things that are going to be essential in this response. I mentioned our messaging, that we had canned messages in place, so it was very easy to edit those messages and get them out quickly to the community. Our disaster guides had checklists that can be easily provided both for our staff to do in the field as well as those restaurants of what they would need to do to get reopened. The most recent fire, the challenges were really the magnitude of it hitting an urban area and the impacts to our water infrastructure, all the different homes that were impacted. We had staff that were impacted. We had staff who lost their residence during this fire. In addition, this was still during COVID, so we had that issue going on. There's just the mental health strains of being in one massive pandemic and then having another huge disaster hit our community, and especially staff who've had to respond to other disasters. There's sort of that disaster fatigue that's significant as well. And one of the things that is a sad guarantee is you will never have enough staff to respond to all the things you need. So back to those relationships and being able to call on mutual aid, bring in additional resources so you do not burn out your environmental health staff. They're going to be involved in the initial disaster response, but they will significantly be involved in the recovery response, which isn't a matter of days and weeks, it's a matter of years. We had to deal with a significant flood in 2013, and that the impact was almost a decade to our community. In fact, I think there's still some of our county departments still engaged in some of the work after that disaster. So know the long-term impacts and be prepared for that, and then plan for support, mental health support for your staff, as well as trying to just find enough resources to deal with all the things that you're going to need to deal with. And with that, I think I can close my part of the presentation and appreciate your time. And I will definitely be actively monitoring the QA and chat. So thank you so much.
Great. Thank you so much, Lane. Great presentation. And we do have some questions in the Q&A. And due to time, I'm going to ask that Lane respond to the questions in the Q&A box as we can, while we move forward with the seminar. Let's see. Next, I want to share with all of you today NEHA's wildfire response guide. We have created a wildfire specific guide that walks you through the potential considerations and roles for environmental public health professionals when responding to a wildfire. The guide includes response and recovery objectives for each environmental health area, template messages, sample forms that can be used to meet objectives, recommended guidance documents, and suggestions for cross-sector partnerships and policies. Lane, I know you were one of the contributing subject matter experts who contributed to the development of the wildfire guide. Lane, would you mind just adding a few more comments about the guide?
Yeah, I think this is a great resource for you to do a number of the things that I mentioned in the presentation, both some pre-planning, giving you ideas of things that you should be thinking about in advance. It gives you some real-time resources so that when you're in a fire, and then also those recovery components of some guidance. There's a lot of great hyperlinks in the electronic version that's on NEHA's website to get you to things that I was talking about of what is a right of entry, what does that document even look like, where do I start? So lots of detail in there to help really get you a long way down the road, things that I think would have helped us as well. So a lot of lessons learned from a number of the contributors in things you're going to deal with and ideas of how you might approach that. And hopefully it'll be a living document. So as others have experience, I think NEHA is very eager to hear how this is working for you. If you have other things that you think would be helpful, that they want it to be a living document. So hopefully you'll find it a good resource. While I hope you never need it, it's something that I hope you do look at so that if you do need it, you'll be prepared.
Great. Thank you, Lane. All right. Well, allow me to introduce our guest panelists who will share their expertise in wildfire preparedness, response, and recovery. Joining our panel today, we have Bill Hayes, who is a seasoned environmental engineer with over 20 years of experience at Boulder County Public Health in Colorado, focusing on air quality and business sustainability. He holds a bachelor's in mechanical engineering from Purdue University, a MS in environmental science and engineering from the Colorado School of Mines, and is a licensed professional engineer. As the air quality coordinator for Boulder County Public Health, he provides critical insight into air pollution issues and guides the public on health protection measures. Bill is also the founder of the Boulder Wine Society, a certified fly fishing guide and former Ironman triathlete. Next, we have Christine Sosko, who has been the Director of Environmental Health for the past 13 years with Sonoma County Health Services in California. She is a member of the California Conference of Directors of Environmental Health Executive Committee, serving as the chair for the Emergency Response and Preparedness Committee, which provides policy-oriented direction related to disaster planning and emergency response procedures. Since becoming the Director of Environmental Health, Christine has led her team to be innovative and found outstanding solutions during numerous disasters, such as the firestorm of 2017, floods, fire and mass evacuations of 2019, and the Glass and LMU fires of 2020. Next, we have Addison Houston, who is a climate adaptation strategist for Public Health, Seattle and King Counties Climate and Health Equity Initiative in Washington State. With over 8 years of experience working in the public sector, Addison integrates his experience in the field of city and regional planning, public health, emergency management, and hazards mitigation to lead the department's efforts to develop strategies and actions that work to mitigate health impacts resulting from climate change to promote climate resilience and health equity in the county's efforts to adapt to a changing climate. Addison earned his master's in city and regional planning degree from California Polytechnic State University in San Luis Obispo and is a standing member of the American Institute of Certified Planners. And lastly, we have Erin Dodge, who is the Water Quality Program Coordinator for Boulder County Public Health in Colorado. During her more than 20-year tenure with Boulder County, she has managed the Household Hazardous Waste Program, supported implementation of the Zero Waste Program for county offices, and worked as a business sustainability specialist on the Partners for a Clean Environment program, which supports a local business to achieve sustainable business practices. Before joining Boulder County, she worked for NOAA, the National Oceanic Atmospheric Association, and the Greater Fairlawns National Marine Sanctuary, which were dedicated to preserving and researching the underwater national park just off the coast of San Francisco. She also served as an AmeriCorps member with Watershed Stewards Project, where she served with the lobbyists to preserve the salmonid habitat in Northern California watersheds. So thank you all for being here with us. Let's get started. I will like to throw out a question to kick off our discussion today. Could all of you help us understand what specialized training or knowledge an environmental public health specialist needs to take part in a response team?
I'll jump in with the answer I think we all have on the tip of our tongues, and that is the ICS Incident Command System. And this was set up by the wildland firefighters for having a chain of command, a chain of communication, as well as documentation to respond to wildfires. And it can actually be applied to any emergency response situation. There are a number of different courses offered directly from ICS. I know a number of universities are now offering these classes for credit as well. And I think, if you anticipate working in a disaster recovery scenario, that to be familiar with that incident command system is going to really benefit you.
Great, thank you. And I also heard that FEMA has some type of a training.
Yeah.
Erin, can you tell us about that?
Yeah, the FEMA has a training at their training center in Alabama, and it's called EDER-OPS for short, and it stands for Environmental Health Training and Emergency Response. And it really goes through how you would respond and all the different roles of environmental health, from water quality to food safety to air quality, setting up shelters, what it might look like to do inspections in shelters and keep those safe for residents that are needing to seek shelter due to being evacuated. And that's definitely a really great foundation. And for those, I think that, there's all the training and all the textbook work is great in terms of understanding, and attending webinars like this are really helpful. But when the rubber meets the road, it's the training that you do if you're already in the field, that you do with your teams, and the planning that you do when you're not in a crisis mode, that is going to be the most important to be prepared. Because I don't think there is any amount of classroom training that you can go to, in my opinion, to really prepare you for all the things that come at environmental health. It's like, oh, well, this is a random question. Let's give it to environmental health. So just really being prepared and having solid plans in place for how to respond and adapt during these emergencies.
Great, thank you, Erin. Christine, do you think you could elaborate on the types of training around preparedness and planning that it takes for a response team?
Yeah, I would add to what's been said already. I think really that preparedness and planning, developing county-wide plans or statewide plans, making sure that all those plans are in place. And I think as environmental health professionals, we have to make sure that we are being included in other agency plans. So when we're looking at, our Transportation Public Works Department, we want to make sure that that element of environmental health is included. A lot of environmental health agencies are embedded in public health, so they get included in that public health plan. But those agencies that maybe are not, we want to make sure that they're getting included. I think, just to echo Erin, I think those tabletop exercises, that preparation that we do, you kind of go through those trainings and you think, well, this will never happen. And what I think we've learned over the years is it's not this will never happen. It's, oh my God, this is so much more than we even trained for. So keeping that flexibility and just I think sharing with your team that these things can happen, and we need to be prepared, and we need to stay flexible, and we need to take it on as a learning experience as we go through it.
Great, thank you. Mm-hmm. Erin, I'm going to jump back over to you to ask you regarding response and recovery. Is there a targeted focus to assist communities that may face challenges due to socioeconomic challenges or other disadvantages?
Yes, I think this is really important. And again, kind of the planning piece. I feel like I'm not going to be able to say planning enough, so I'm just going to ask you all to hold on to that. But from a climate justice, environmental justice perspective, when you look at the legacy and the history of that, it is always these disproportionately impacted communities that tend to suffer the greatest. And we also know that based on various circumstances, they're also not the community members who are maybe most comfortable coming forward and raising their hand, asking for help. And because they're not going to be the loudest community members, they're going to be the first to be overlooked. And if you're from a planning perspective and a response perspective, planning in advance, knowing where these communities are, knowing how to engage with them, having relationships with those communities is absolutely vital. And if it's not very clearly built into those response plans, I think then those communities will just continue to be further impacted by the lack of resources during recovery, which is really where environmental health kicks into high gear, I think. So I think that it is really crucial, and especially in that planning phase, to know where these communities are and build those maps out and try to build relationships before you're in a crisis.
Yes. Addison, I know that Seattle and King County Public Health have really worked on an environmental justice program that you guys have been able to filter down into all the different environmental health fields that you guys focus on. Can you elaborate a little bit on and what that looks like in your program?
Yeah, so for King County, I mean, we've been fortunate enough that we haven't had to deal with wildfire fronts themselves in terms of their impacts to populated areas, but we do generally deal with the broader impacts of wildfire smoke exposure and the impacts to air quality that has. And what we do see with air quality pollution from wildfire events is it's really disproportionately affecting people that already have existing health conditions. And a lot of that is driven by existing disparities from housing quality and access to proximity to industrial sources such as high traffic volume roadways, as well as other industrial activities. So we've done a number of targeted measures and efforts throughout the last couple of years to really try to distribute air filtration technologies to people so they're able to protect their health in their own homes, recognizing that there are cost barriers also to some of those air quality interventions, with in particular the portable HEPA air filtration units. So we've been trying to actively promote and distribute the do-it-yourself box fan filter kits, but also continuously doing evaluation to really ensure that the resources that we're providing to communities are as effective as we believe them to be, which it's actually there is a bit of concern that we are starting to uncover with the use of the do-it-yourself box fan filter kits, where they don't unfortunately tend to have the efficacy in applied settings that we'd hope they would. So we really are trying to package this in with a lot broader education to really elevate the importance of air quality, point out different things that people can do within their own homes to reduce internal generation of air pollutants during wildfire smoke events. So that way they can kind of start taking a combined or multi-pronged approach to reducing their exposure to poor air quality, particularly during these wildfire smoke events when air quality can be bad or unhealthy to hazardous for days on end. So it's we really see this continuous link back to housing quality, and that is an area that we unfortunately haven't been able to make as much progress as we would like to, but it is somewhere where we are actively putting a lot of our efforts and trying to promote that people's ability to protect their health during these climate hazards, whether it's extreme heat, wildfire smoke events, or dealing with wildfires themselves. It's not something that somebody's exposure is dependent upon their ability to pay more for housing.
Great, thank you so much, you guys. Let's see. So Lane brought up the issue of staff burnout. And I wanted to see, Bill, do you think you could elaborate a little bit more on what that looks like, what are the signs, and what are some remedies that agencies should be looking at?
Sure. And before I get to that, I did want to add on to what Allison and Aaron both were saying about, our disproportionately impacted communities. And I just put in the chat a link to GRIST, and they're an organization that works on climate justice. And they just came out with a really good national map. You can zoom in to the neighborhood level. You can select different filters, but it helps you see both which neighborhoods in your area are most likely to be impacted by climate and what type of impacts those will be, whether it's heat, drought. And then also it has a socioeconomic layer, so you can see which of those communities have the least resources to respond. So take a look at that. I think it's a good tool to have. Then
Great, thank you.
As far as burnout, and I'll say the planning word again for Aaron, and the planning and training ahead of time really makes a difference. I was, looking back at one of the slides that Lane put up of the historic wildfires in Boulder County and remembering, oh yeah, 2010, that one. And, 10, 15 years ago, Aaron and I and Lane involved in public health that long. When we'd have one of those disasters, there were only a few of us that were trained and able to go to our emergency operations center. And, we'd jump in and work 24 hours straight and, 80 hours in the first week and just absolutely get burned out, and to the point where, you're not making good decisions. And so we've learned over many of these incidents that we have to have, a good deep bench on the sideline so that we aren't burning out the same key personnel every time we have an emergency, and making sure that we're switching people in and giving people rest. So, planning ahead on that mental health part, staff burnout part is really important. And then, recognizing that this truly is a mental health concern. And so, during COVID and during the Marshall Fire, Boulder County Public Health, we brought in mental health professionals and offered counseling, free of charge, made that available to staff. For some people, that was the right thing that they needed. For others, we set up just like a weekly group check-in. And, you could get together with your colleagues and talk about it and, really lay out your feelings and emotions there. And, a lot of times getting it off your chest helps, but it also helps to hear that, hey, you're not alone. You've got colleagues going through this. So, when you put together your emergency response plan, it needs to have a section on what you are going to do to support and address the mental health of your staff working on that. And I just note my father, his entire professional career was a psychologist. And once he retired, he volunteered with the American Red Cross and would go to disasters to debrief the first responders. And the very first incident he went to was the Oklahoma City bombing. And, I've heard terrible stories out of that. But, he said he had first responders coming in every day at the end of their shift debriefing, and, that they were just an absolute mess. So, that's certainly an extreme, but it shows that you can't spend all day trying to help other people recover from their disaster and not take some of that mental toll on yourself.
Great
I would
advice.
want to.
Thank you, Bill. Please go ahead.
Just chime in. I typed this in the Q&A a few times, but that mutual aid need is so critical because environmental health gets called often, and I'm sure we're not unique in Boulder County, that you're going to be part of that emergency response. So when they activate the emergency, and the incident command system, you're going to be playing roles. And that's how it has worked historically for us as we get called on, staff wise to fill those roles. Then once it moves into recovery, it almost shifts entirely to environmental health. There'll be a few other, county departments engaged still, but EH will be on the hook for a long time. So that's why it is so critical to be thinking about this. If you've burned your staff out during the emergency response, you still have years behind you of stuff coming your way. So that's why you can't take, just can't not factor that in. It's so critical. And I think my colleagues know it too. We had another potential fire a year later, and I remember talking with Erin. She's like, "Oh my gosh, I cannot even fathom this happening again." And luckily, that one did not become anywhere near the same impact as the Marshall Fire. They were able to get it under control very quickly. But yeah, that post-traumatic stress that staff feel of the idea of having to go through this again and respond to all those issues again, even though you have some skill in doing it, doesn't make it any easier each time to still have to go through and do all those things. So planning for mutual aid and then implementing those agreements very early on is really critical, and bringing in as many partners as you can.
Great. Addison, do you want to speak a little bit about the types of local, state, federal partnerships that you've found to be critical?
Yeah, absolutely. So again, kind of turning a little bit more to the smoke and then the long-term recovery efforts. One of the critical partnerships we've found to be really essential is working closely with the National Weather Service, because they can do a lot with regards to forecasting. Now, with dealing with wildfire smoke and trying to forecast wildfire smoke impacts on the air quality, you're taking the science of wildfire behavioral modeling and then the science that goes into weather forecasting and combining them. And it is a very messy situation where the predictability beyond a 48-hour window is very questionable. But we found with working with our National Weather Service as well as our local clean air agency that does the implementation of the Clean Air Act, we are able to effectively understand where our monitoring sites are in their distribution across the county, as well as identify where there are critical gaps where we don't have accurate information. And that's really important because if you're just going into one of these events and hoping that your network is going to be sufficient enough to give you the level of detail and accuracy of data that you're looking for to inform your public, you're going to be a little bit in a tough spot, because in most cases, the ambient air quality monitoring network is not well distributed. It's really very much oriented towards the objectives of the Clean Air Act, which doesn't cover the entire population centers. So what we end up having to do is leveraging where existing resources we have with the air quality monitoring network, and then really turn towards the use of these low quality, or not low quality, low cost air quality sensors, such as the Purple Air or Kytera air quality monitors. Granted, there is questionability in some of the accuracy of that data, but it does help us inform things to at least be able to make informed decisions when we're advising on recommendations for people to protect their health from wildfire smoke events. And then it's been said a couple of times, the impacts of wildfires do extend well beyond the period of just the burn. And we are still actively monitoring burn scars that there are now real risk of debris flows from if we have heavy rainfall events on those burn scars. So we're constantly working with the National Weather Service to monitor the forecast, keeping an eye out if there's any storms that pose additional risk to debris flows from where those burn scars are. So it is a combined approach with working with our National Weather Service, working closely with our state agencies. So we have close partnerships with Department of Health to ensure that all counties that are dealing with these issues, since fires and smoke, they all cross county borders, making sure that all of the county agencies that are dealing with these issues are doing so in a coordinated approach, because where things go sideways really fast is if you have discrepancies of how jurisdictions are handling and dealing with the situation. So ensuring there's that regional coordination with all entities, regardless of those county boundaries, is really significant. And then, yeah, leveraging those federal partnerships with the National Weather Service as well as the USGS to really understand what are the ongoing risks that will continue to exist beyond that wildfire period, and just making sure we're actively staying aware and monitoring that so we're ready at a moment's notice to respond if additional concerns do arise.
Great, thank you, Addison. I know it was mentioned in a previous conversation that there are also some challenges that environmental health faces with some partners or volunteer organizations. Can any of you speak on that just for a moment?
I can share a little bit that I think it's really important to know. Like here in Colorado, we don't regulate drinking water. It's our state health department. Our private well owners are fairly unregulated, with the exception of getting a permit to install a well. So I think really on making sure you have a solid understanding of who's doing what and who's going to do what during an emergency. And also looking at what are the regulatory requirements for cleanup that might exist within your state. Colorado really doesn't have any standards. So when Addison was talking about that jurisdictional line and disasters don't know boundaries. So it could get really challenging if one county has really strict requirements for cleanup and another county has really low expectations. That could really create challenges. So trying to implement those policies and hopefully at the state level early on. And then, the volunteer organizations are really helpful. But I think that engaging with those folks ahead of time before disasters so that messaging is clear and consistent. It's unsafe to sift through your ash, but then potentially handing out equipment to go and sift through the ash by the volunteer organizations can get complicated, and just trying to have consistent messaging and coordination across those. Which is overwhelming because they do descend upon the community during the time of disaster and they're really needed. So trying to figure out how you can do some of that coordination ahead of time.
Great, thank you so much.
Then real quick, if possible, one of the positions, and Lane touched on this briefly, but one of the positions environmental health often gets put into the place of is residents want to know, especially if their house is still standing, if it's safe. And this is a position that environmental health gets put in time and time again, but it's, as Elaine mentioned, our business is not to determine whether it's safe or not, it's to reduce the risk that exists after the event. And we will continuously be having to deal with this where community is going to want to know if it's safe for them, but I mean, that is a determination where it's like, we can't go in and assess all potential risk, and to make that determination if they're safe carries a ton of potential liability that environmental health professionals need to be very careful in navigating and really set that bar at risk reduction and not determining whether it's safe or not for people to re-enter.
Such a key factor, and presenting information is what we ended up doing in this most recent fire. Of here's how you can make a determination for your health. Here's the risk factors, because everybody's health is different and some people are higher risk. So important. What a great point.
Yeah, thank you. Definitely. And is one of the things that we did after the Marshall Fire, we put out a few flow charts to help people gauge, because every house had different levels of impact. And so, yes, as Addison said, we can't go door to door. So giving flow charts and so people can determine that for themselves. And I think, that is important, of giving the residents things they can do to protect themselves. It reduces stress. It makes them feel like they're an active part of the recovery and, not just a victim sitting on the sidelines waiting to be helped.
Yes, thank you. Well, we
Just-
have approached the last minute of our seminar today. I would like to take a moment to thank our guest speaker, Lane Drager, and thank you for presenting today. And to our panelists, Bill Hayes, Christine Sosko, Addison Houston, and Aaron Dodge, thank you for providing a great discussion today. We really appreciate it. And thank you to our audience for attending today's seminar. Following the closing of our seminar today, each of you will receive a request to complete an evaluation survey where you'll be able to provide your thoughts and suggestions on the seminar today. And please include any other additional questions that you may have, and I will be able to forward those on to our speaker and panelists. We appreciate your feedback as it assists us in being able to meet your needs in the field. Thank you again and have a wonderful day, and we'll see you next time.